if you look back at the history of telemedicine and adoption of that, the American Indian Alaska Native tribes, especially Alaska Natives, one of the pioneers in really embracing telemedicine concept out of necessity, right? I mean, you would imagine vast distances, long winter, lack of enough number of specialists to deliver care. They had to rely on emerging tech such as telemedicine. So I think by what starts out as a constraint-driven innovation in Native community, now we see that those same lessons are applicable even in a more denser populated area, such as the Northeast. Our tribe, Mashantucket Pequot Tribal Nation that I serve, is a federally recognized Native American tribe, one of the two in the state of Connecticut. And the tribal nation's membership, including its own community as well as employees and dependents, are served by the tribe's own self-funded, self-insured health plan. So it's the right confluence of not only population health management in a Native community, but also what are the lessons that we can learn from our sister tribes in Alaska around adoption of telemedicine, even though distance may not be an issue for us, because more and more folks, either by choice or by necessity, they still prefer to have a digital access, a digital doorway to reaching for care, and then have the benefit and the luxury of having an on-site, high-touch clinical system that we already have in place, as well as a high-tech access point as and when the need for a variety of different reasons. And so, our overarching goal at Mashantucket Pequot Tribal Nation is to really strive towards that objective one and build a humane, trust-based system that is both high-touch, which is in keeping with the Native tradition of being with someone, right? And it's a lot about face-to-face. It's a lot about actual hands-on. At the same time, build the high-tech component so that for disease states that are, much more still of a stigma, unfortunately, people can access behavioral health care, mental health care. They can access nutritional counseling, metabolic disease treatment, reversals, smoking cessation, all those through either on-site clinic, or we offer them a digital solution for the same. So our goal at MPTN is to really go back and connect with Native practices and traditions as a preventive way of living, but at the same time utilize the ancient wisdom with modern medicine and build a system that is both a hybrid of high touch